and welcome to the third in our series of video logs for Maternal Mental Health Week 2023. This video is being produced for day 3 of the week, which is also World Maternal Mental Health Day. And we at PIMS today we're speaking to Koraima, who is doing some work with the Butterfly Baby Clinic in Scotland. My name is Emma, and I am the comms officer for Parent and Infant Mental Health Scotland, and I'll be chatting to Koraima today a little bit about her work, her involvement in the Butterfly Baby Clinic, and the kinds of outcomes that they're looking to achieve for families across the world in the partnerships that she's involved in. So thank you very much, Koraima, for joining me today. Do you want to start by introducing yourself? Tell me a little bit about yourself and your history and what's brought you to where you are today.
Yeah, sure. Hi, everyone. It's glad to just see you, Emma. Thank you for the invitation. So, I'm from Ecuador. I'm doing my PhD here at the University of Edinburgh in clinical psychology. And when I was in Ecuador, I used to be an accredited psychologist. So I used to work with families with neurodevelopmental, with children with neurodevelopmental difficulties. And that is something that just changed my way of looking at life. I guess I have always been an advocate of mental health and how family is kind of the base of everything else when you're just talking about your mind. And then when I was doing my master's, I came to Edinburgh, and that's how everything started. I wanted to be a little bit more involved in research because I was doing my clinical practice, but something was missing. So I decided if I want to make a change and still be also practicing a clinical base, I will need to also contribute with some research. So that's why I applied to a master's here in Scotland. I got accepted. I moved all my life here. And while I was doing my master's, this need, it came up from my previous experience that I wanted to do something else, like for a change, and not just studying. So there was a summer project in the university that was working with babies and families. And just connected to my previous experience and what I truly believe that can make a change in families' life that really needs something. I just joined the summer project, and that's how I get involved in the Butterfly Baby Clinic that we're talking about today. Yes, that's mainly why I'm here and who I am.
Fab, that's great. So you've told me a little bit about what motivated you to get involved with the clinic. Can you tell us a little bit about the clinic's work generally, what they do in Scotland as well?
The clinic was founded by Dr. Angela McLaughlin in 2014, I think, more or less. Then the pandemic hit. She was still teaching here at the uni, and just to match with the needs and with anything that we can do while all the social distances and the lockdown, this joint project with the uni started. But basically, to answer your question, the Butterfly Baby Clinic is a non-profit organization that just tries to promote development and well-being of babies. And how we do that? Well, we're working with parents, working with families, and also working with babies at some point. Yeah.
Okay, brilliant. And so you've been involved in a couple of the clinic's projects with overseas partners. Do you want to tell me a little bit about those and how they started up?
Yeah, sure. So the clinic has different mini sub-teams. One of those sub-teams is a team called 1001 Think Tank Project. And the main aim of that specific sub-team is just to promote knowledge exchange and just reach more people around the world. Because one thing is just do it locally, but we can also just explore other international possibilities. There is a lot of needs in certain countries, especially low middle income countries, to get these things across, because sometimes the difficulty is that information never reaches the country. So as part of this project, this 1001 Think Tank Project, I think it was like 2 years now, yes, ago, we applied for a student experience grant with the University of Edinburgh with another student and also Dr. McLaughlin. We got the grant and we started working with an organization in South Africa that is called Ububele. So Ububele basically works with families and babies, of course, in Alexandria, that is a town in South Africa. And they just trying to give them a space to promote also development, well-being, answer any question they have, also support mothers and families and the community and the babies, of course. So with this project, what we did basically is that get in touch with the parents, families, and Ububele as an organization to co-create resources with a couple of students from the uni that from now on I will call them Changemakers.
Yeah.
So the basic idea here is that we can just get together with the families and also from our side and start exploring their needs and create resources and also try to explore the possibilities of just give the things that they need in order for them to just promote their baby's development and also their own well-being and mental health as a whole with an integrative perspective that is not just give them the activities, but also sometimes it's also give them some physical no, not so physical objects, but at least cover the basic needs that they have. So in the case of the project with Ububele, what happened is that we start exploring the possibility of just what they need, and it seems that at least families within the organization in South Africa were requiring some sort of activities for the babies. What actually do to promote certain things, how they can improve the father's involvement with the babies and so on. So we create a couple of digital resources with the change makers and the families. And then we also saw that there was a need of get some basic stuff for the babies, because it seems that most of the families when they have their babies in the first months, it's very difficult to have like basic stuff. We create a baby bundle that was a physical bundle that was delivered for families, as well as the digital resources with all these kind of requirements that they had from their side. And that's what happened, at least in the Ububele part of the project.
Fab. And did you get any kind of feedback about the benefits that this had for families? Or
yes, we got like a large digital event because we couldn't, of course. But the families received the bundle. Also there we have like a very positive feedback about how the resources actually works. I remember that was this father in particular, that at the beginning he was kind of hesitant of, how this will help me. But at the end he was very proud, not only on seeing the finalized product, but also being involved in every step of the process. So actually engages with us. The mere act of just working with us promote the first need that they have, like how I just can get involved a little bit more with my baby. Yes.
Okay, that's brilliant. That sounds really positive. And so you've now got a new project started up in Ecuador. Can you tell me a little bit about how that came about and where things are with that at the moment?
Yeah, sure. So at the moment, what we are doing is just start slowly planning of how we can also do something similar, but in Ecuador. In Ecuador, there is not large organizations as Ububele working just with babies. So what we did is approach a couple of professionals in universities in the capital or around Ecuador that are actually working with those families. So for this, we just get in touch with one of my colleagues back in Ecuador, and that was just kind of close to a professor that is working with mothers and fathers and babies in the capital. And apparently they have conducted like a mini study in a center of applied and developmental psychologies of one of the universities in Ecuador that is called the Catholic University. And it seems that Well, then just to give you a little bit of background about this, Ecuador is a transition country. So most people that are migrating from other countries across Latin America, they need to cross Ecuador, regardless, wherever they are going.
Yeah.
So that's why in the last few years, at least in Quito, that is the capital of Ecuador, there is a lot of migration of many different countries. From Venezuela, from Colombia, you can tell, like from up north of South America, they are just trying to reach Chile or Argentina. But they need to cross Ecuador. So that journey, most of the family just stay in the capital because they cannot work anymore. But with those things, that means that most of the people that migrated from other countries, and also there is a very large internal migration from the provinces that are outside the capital to the capital to like for opportunities and to explore like a better life, these kind of things. But with this migration, what it happens is that all the community that supports the families that migrate is just not there anymore. So what the families try to do, at least families with babies, try to reach for help, and that's why they ended up in the Center of Applied and Developmental Psychology. And with all these needs and this study that has been conducting with this professor, they discover that most of the mothers and fathers just feel that there is a lack of community at all. And we already know that there is very important to have that social support when you are just having a newborn. It's very important. It takes a village to raise a child. So we explore, and that's why kind of the context of how we're just trying to exploring what we can do in regards of helping also and co-create any resource or any kind of knowledge exchange with Ecuador. And it seems that the way to go in this at least first step of the project is try to at least co-create some sort of guidance of an to how to, I don't know, conduct certain workshops to build community within these families. That is at all, there is nothing like this at all, at least from the government. So I think that's one kind of the possibility to just explore and trying to improve and create community somehow, and just letting this community know about what is baby behavior, what they can do with the resources that they have to actually promote their baby's well-being and mental health.
Okay, brilliant. And that sounds really exciting and a really good opportunity to be making a difference to families that obviously are needing that extra bit of support. Is there anywhere that people can find out more about the Butterfly Baby Clinic if they would like to know more information?
Yes, you can go to our website, that is www.butterflybabyclinic.org.uk, and then you can explore all the projects that we're running at the moment, what is the organization about, and all the information on how to contact us.
Okay, that's great. If anybody's watching and would like to find out more about Parent and Infant Mental Health Scotland, you can follow us on Twitter at PIMHScot. Our new website will be launching soon, not quite there yet, but it will be coming soon. And if you've got any questions, you can email us on info@pimhs.org.uk. That's pimhs.org.uk. In the meantime, thank you very much to Koraima for taking the time to speak to me today. And thank you very much for watching.
Yeah, it was a pleasure. Have a nice day.
Thank you.